The following Agios-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak with your healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
Welcome back to Just Listen, Voices of PK Deficiency. I'm your host, Dr. Rachel Grace. I'm excited to introduce our guest today, who is a wonderful colleague and friend, Dr. Satheesh Chonat. Dr. Chonat is a pediatric hematologist at Aflac Cancer and Blood Disorders Center and at the Children's Healthcare of Atlanta, and an associate professor of pediatrics at Emory University School of Medicine. Dr. Chonat is an expert in red cell disorders and leads a basic science lab focused on understanding red blood cell physiology, transfusion medicine, and complement biology. He also leads clinical trials of treatments for red cell disorders, including pyruvate kinase deficiency. Dr. Chonat is a co-author of the recently published international guidelines for the diagnosis and management of PK deficiency. Today's podcast is focused on understanding management of anemia in PK deficiency, and in particular, the role of the spleen. Dr. Chonat, welcome to today's podcast.
Thank you, Dr. Grace. An absolute pleasure to be here.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, professionals, partners, and each other. Building on these connections and the company's unmatched leadership in the field of cellular metabolism, Agios is pioneering therapies of genetically defined diseases, a broad group of rare and more common diseases that are typically severe and life-threatening. Near term, Agios is focusing on advancing a clinical pipeline of medicines for hereditary hemolytic anemias. To learn more about PK deficiency, visit knowpkdeficiency.com. That's knowpkdeficiency.com.
I thought we could start by having you share with us how you became interested in research in hematology and taking care of patients with rare anemias and PK deficiency in particular.
Yeah, absolutely. I was actually a neonatologist in England for many years. During my neonatology years is when I actually got excited looking at the blood smears, especially because many of the premature babies are anemic. And that's when I got excited to look at abnormally shaped red blood cells from a variety of red blood cell disorders, which kind of leads to anemia. And that kind of drove me to hematology and then eventually studying or understanding why the red blood cells break down and how it can cause not just acute anemia, but long-term problems in many of these patients. And further on, I've kind of gone back into the lab, trying to understand why some people struggle more than the others with regards to anemia.
I think your role is really interesting in that you're someone who works in the lab, but also is involved with clinical trials with patients. How does that work in your clinical practice?
Yeah, I think it's the patients which have literally drive me in terms of going back into the lab, understanding the missing gaps or the unknown answers. And so it's seeing patients which I still enjoy the most and seeing them in my clinic and trying to understand why some respond to certain treatments and or certain investigative clinical trial medications, etc. And that actually what drives me to go back and using some of the patient samples. And then we try to use other animal models or other testing which are done within the laboratory setting to help understand why this happens or why it does not happen in some patients. So being in that translational space between the basic science work in my lab and also seeing patients, not just clinical trials, but also looking at rare undiagnosed anemias. Actually, we learn a lot. And it's interesting because as hematologists, we not just take care of hematology, but we actually take care of a wide variety of diseases and systems in the body, which is actually one of the reasons that I became a hematologist and also do research.
When we talk about management of congenital hemolytic anemias, we often consider the role of removing the spleen. Can you explain what the spleen is and what it does?
Yeah, it's an important question. Spleen is a very useful organ, but it's not necessarily a vital organ because we can remove the spleen, so then we can still survive. So it's a very useful organ. Its important function is to fight invading bacteria or germs in the blood because it actually contains infection-fighting white blood cells. It also not only controls the level of these white blood cells, but also controls the level of other blood cells such as red blood cells, platelets. More importantly, each time when a heart beats, the blood is going to flow through the spleen and so the red blood cells and other cells go through the spleen and come back in the bloodstream. And as it flows through the spleen, it passes through several of these narrow passages within the spleen. So the healthier red blood cells simply pass through the spleen, continue to circulate throughout one's bloodstream, but the misshaped red blood cells or even other cells gets broken down or trapped in the spleen by these other white blood cells called macrophages, or these large white blood cells, and they remove these abnormal red blood cells. So while spleen is an important organ for us, it's even more important while we understand anemia or anything related to an abnormal red blood cells.
So why would a person with PK deficiency have a splenectomy, or why would removal of the spleen potentially help anemia in PK deficiency?
In pyruvate kinase deficiency or in other deficiencies related to red blood cell membrane proteins, a red blood cell has several proteins which helps to make the scaffolding of the capsule of the red blood cell. When there is deficient in the enzyme or the protein which keeps it stronger, these red blood cells become abnormal, gets even broken down within the blood cell, or more importantly, these abnormal red blood cells get trapped in the spleen. So as one may imagine, with this chronic and ongoing retention of these abnormal, misshaped red blood cells, the spleen can get enlarged, or what we call a splenomegaly. So it's a common finding in children, adults, and studies have shown over 80% of children, adults with pyruvate kinase deficiency actually have enlarged spleen or splenomegaly. But the severity of this enlarged spleen can be broad, meaning individuals may have just mild symptoms, or they could have symptoms just related to this big, large spleen sitting in the abdomen, which can cause a lot of discomfort, sometimes pain because of the stretching of that capsule within which the spleen is sitting. In some patients, what we see is that we call this a condition hypersplenism, meaning that the spleen is overfunctioning, as you can imagine, because of these red cells are going through the spleen and they're trapping it all the time. So they can have worsening anemia where their bone marrow is trying to make more and more new red blood cells. And in a child, it can actually also affect the growth in a child because of this chronic anemia or this hypersplenism. It can also, because the spleen is trapping red blood cells, unfortunately, it also traps other blood cells like platelets or white blood cells, so they could also become low in the blood. So splenectomy is indicated in those individuals with pyruvate kinase deficiency who may require regular transfusions or who may be severely anemic, or you may have symptoms because of that massiveness of the spleen.
Spleen also has an effect on reticulocytes in pyruvate kinase deficiency as well. Can you talk a little bit about that?
Yeah, so reticulocytes are these immature red blood cells that our bone marrow makes. And typically we have about less than 1 or 2% of all red blood cells in our bloodstream are reticulocytes. But whenever there's anemia, our bone marrow is trying to make more and more of that reticulocytes. And more importantly, they're getting pushed out of the bone marrow before they're completely mature. So the number of reticulocytes actually goes up during this chronic anemia. And because of this large spleen, when there is high functioning of the spleen, these numbers go up, meaning there's increase in this immature reticulocytes going up, coming out of the bone marrow. And some of these patients actually also experience what's called as a hemolytic episodes, where these red blood cells actually break down during periods of infection and so on. So it's important that we monitor not only the spleen size and anemia, but also always pay attention to the reticulocytes in patients with sickle cell disease. Patients with pyruvate kinase deficiency.
The reticulocytes too, I think, require more energy than the more mature red cells and have trouble maintaining that in the splenic environment. And so they, I think, tend to be more easily destroyed in circulation when they pass through the spleen because they rely so heavily on ATP production. And so when someone who has pyruvate kinase deficiency undergoes splenectomy, there's often increase in the reticulocyte count, not because there's more red cell breakdown, but because the reticulocytes can survive longer without having to pass through the spleen and the environment there that's not conducive to producing ATP.
No, absolutely, yeah. And they're also bigger in size, so more easy to get trapped in the spleen.
When you're talking with families with a young child with pyruvate kinase deficiency, how do you think about splenectomy, and what are some reasons why why families or providers might recommend delaying splenectomy?
Yeah, that's an excellent question. To some extent, when we talk about the reason for splenectomy or should we delay a splenectomy, or what is the correct timing for splenectomy, it's important to emphasize that this is very patient-specific. So we have to take into consideration that particular patient in discussion with the family members and the patient, if possible. Because while splenectomy can improve the quality of life in some patients and reduce the transfusion burden and also improve the hemoglobin, it can certainly come with few risks. More importantly is the high risk of infection or sepsis, which is a severe bacterial infection. And this occurs because we mentioned earlier, spleen is present to help clear this bacteria. This severe infection or sepsis occurs typically in younger individuals, those who age less than 2 years of age, or more so up to 5 years of age. Therefore, delaying splenectomy until 5 years of age is, if possible, is strongly recommended. And more so, it should be delayed till these patients have received all vaccines per the guidelines by the Centers for Disease Control for anyone with absent spleen or asplenia. Other reasons to delay is if it's possible, if there's a clinical trial for a patient with pyruvate kinase deficiency, then it should be offered as an option, especially for a child, since currently medications are not approved for over 18 years of age with pyruvate kinase deficiency. So certainly the option can be revisited in those patients. So it's more importantly, I think it's the risk of infection, and also delaying at least 5 years of age is strongly recommended, especially if you're talking at that younger individual.
And you mentioned the infectious risks associated with splenectomy and not having a spleen. What are some of the other complications that can happen after splenectomy?
Obviously, it can be immediate or delayed risk. The immediate risk, like with any surgery, anesthesia, generally, it is a safe procedure, and often the surgeons will decide to remove spleen laparoscopically or through an open abdominal surgery. But I think in addition to this big infection risk that we talked about, the lack of spleen increases the risk of blood clots, thromboembolism, which is seen about 10% of patients with pyruvate kinase deficiency after splenectomy. And these blood clots can occur because spleen not only, as it clears the bacteria, but also helps to act as a filter or sieve to remove some of those smaller particles that we have in the blood, as it filters out these smaller particles, which could be from broken down cells or tissues. So when there's a lack of spleen, it increases the risk of these blood clots in the leg veins, so veins of the liver, or in the lungs called pulmonary embolism, or even stroke. So in addition to the blood clots, some of the other rare complications of removing the spleen are sometimes it can have a very high platelet counts, which can also theoretically, in addition to other risk factors, can increase the risk of blood clots or even stroke. And I think we know, following patients for many years, removing spleen, while these risks are certainly high, they are lifelong risks. So it's important to actually counsel these patients or families long term, because older adults may even have some of these complications related to the heart from removing the spleen. We're learning more about it and hope to know more as we do these large-scale studies in older adult individuals.
I think what you mentioned about splenectomy in the older population is incredibly important. We see in some of our patients who have splenectomy for other reasons that adults often forget about risks associated with splenectomy once it's been many years since they had that procedure. And I think it's incredibly important for anyone listening who's had a splenectomy to make sure that they remain up to date with immunizations, that the recommendations around which immunizations and which boosters changes every year. And so looking at published guidelines, for example, like you mentioned from the Center for Disease Control, making sure that you're up to date with vaccinations, and then also about management in the setting of a fever, that there's the need to be seen urgently within the hour of a fever to get a blood culture and to get IV antibiotics to cover for a serious bacterial infection, which can happen at any age from any length of time once the splenectomy has occurred. And so I think families are very knowledgeable in the near term to when they've had a splenectomy, but then as time passes, I think people forget that they need to be checking in about immunizations and remembering about careful fever management.
Certainly great points about lifelong risk of infections after splenectomy.
When you're thinking about individuals with pyruvate kinase deficiency, you mentioned that the decision-making around splenectomy does need to be individualized. How do you think about that in an individual patient in terms of their transfusion burden or their baseline hemoglobin or level of hemolysis? Do any of those factor into your decision-making with a family about recommendations for splenectomy?
Yeah, it's an excellent question, because we already discussed some of the risks of splenectomy. So it's important we have to weigh those risks of splenectomy against the risks of ongoing treatment for that particular patient of pyruvate kinase deficiency. It could be a chronic blood transfusions. Some of these patients could have iron overload from chronic anemia and transfusions. So it's important to look to, are they having side effects from iron overload? Or are they using chelator medications, which are medicines that are used to remove iron from the body? So it's very important that these considerations regarding the timing of the splenectomy, when to have one or not, need to be very patient-specific with the discussions with the provider and family. Certainly, as discussed earlier, we want to delay it at least till 5 years of age if possible. So that's an important consideration to have. And keeping in mind, if the patient is chronically transfused, is removing of the spleen is actually going to benefit. We know that the response to splenectomy is variable in pyruvate kinase deficiency. While we've seen some improvement in the hemoglobin concentrations after splenectomy, this about 20% of the patients will not have any response to splenectomy. And we think that especially those individuals with pyruvate kinase deficiency and who have severe anemia are less likely to respond to splenectomy. So it's important to take into consideration the severity of anemia, if there's iron overload, the frequency of transfusions, and help understand the family that not every patient, not every person will benefit from an increase in hemoglobin or reduction in the transfusion burden. And so with regards to transfusions, these considerations will be helpful, especially with child and parents, so that they understand what to expect. And as mentioned earlier, I go back into seeing if there is any potential other options, especially nowadays, other than transfusions and splenectomy. There could be a potential clinical trial for patient with pyruvate kinase deficiency, especially if they're under 18 years of age. So that can be offered as an option if this and the splenectomy can still be revisited later on.
I think the conversation is quite challenging. The international guidelines that we were both a part of really point to the importance of shared decision-making and individualized recommendations around splenectomy in individuals who are older than 5 and have symptoms of anemia or require transfusions. But it is challenging in the setting of knowing that those with more severe anemia, higher transfusion needs, higher hemolytic rates are less likely to respond to splenectomy. And of course, those are the patients who are often really considering splenectomy, wanting to make an impact on the severity of their anemia or the frequency of transfusions. And so that can be, I think, quite challenging in terms of going into a surgical procedure that's irreversible and recognizing that there may not be the benefit that you're hoping for.
Yeah, no, absolutely, yes.
What is a partial splenectomy, and is this considered in pyruvate kinase deficiency?
It's an excellent question. So partial splenectomy is where that some surgeons, not all surgeons, are willing to review the spleen, because we know that spleen is an important organ. That is it something that they can go in and take a significant portion of the spleen, but still leave a small portion of the spleen there, which can potentially continue to help provide a benefit against infection specifically. So it's not completely removal of spleens, it's a partial removal. It's very variable. It's somewhat dependent on the patient and the surgical experience, expertise, and what the surgeon may encounter during the procedure. We certainly offered it and have been part of a prior study looking at partial splenectomy in patients with other red blood cell disorders. But unfortunately, the data hasn't shown to be hugely beneficial of removing partial spleen, because sometimes the spleen can grow back up again, which is a concern. So in spite of going through a surgical procedure, if there's a growth of spleen, we may be back to our baseline as where we started off with. The current guidelines, the international guidelines for pyruvate kinase deficiency, do not recommend a partial splenectomy for patients with pyruvate kinase deficiency. And that's certainly been our practice.
And how about a laparoscopic splenectomy versus an open splenectomy? How do you consider those?
That's a good question. So once we make a decision of splenectomy, or even during the decision-making period, I often recommend patients and families to actually meet with the surgical team who can discuss the ways to remove a spleen with the particular patient and also the family. Because sometimes if the spleen is really large, it can be quite challenging to remove it piecemeal through a laparoscopic procedure, and also understanding that any of the laparoscopic procedure could potentially be converted into an open surgery, meaning that they have to cut open the abdomen to go inside and remove the spleen. And spleen, as you can imagine, there's a lot of blood cells inside, so there's high risk of bleeding. So several considerations need to be taken into account while laparoscopic versus open surgery are planned the surgeon. The other big question is, should we remove the gallbladder when we remove the spleen. And often it's asked, even if not asked by the family, it's also asked by the surgical team, because the risk of gallstones are high in patients with hemolytic anemia, especially with pyruvate kinase deficiency. So the decision is made definitely to remove a spleen. I think many providers and surgeons and families actually opt to also remove the gallbladder at the same time. So hence whether it's laparoscopically or through open surgery. So these things again needs to be a shared decision making, understanding the risks between the surgical procedures, and also that removing a gallbladder is actually a reasonable option in patients with pyruvate kinase deficiency, just because they are at a high risk of gallstones and might even need a removal of gallbladder later in life. So if we can avoid 2 procedures and avoid additional anesthesia, and certainly something that needs to be considered.
This is such an important point, and we know pyruvate kinase deficiency is different than other congenital hemolytic anemias, of course, in many ways, but in particular, in terms of the rate of hemolysis after full splenectomy, that splenectomy and pyruvate kinase deficiency is only partially effective. So there's always ongoing red cell breakdown afterwards. So that risk of gallstones continues after splenectomy. And this is different than in some other congenital hemolytic anemias in which splenectomy fully resolves the hemolysis and there really isn't an increased risk of gallstones after the procedure. So this is where it's helpful to have a hematologist help to guide the surgeon to know that this is different than maybe some other more common congenital red cell disorders that they've encountered more frequently in terms of risks of later gallstone after the procedure.
Excellent point. We actually routinely recommend an abdominal ultrasound to look for gallstones in these patients, especially when they have a large spleen, which also helps in the decision making for the family and also from the surgical team.
You mentioned this already a little bit, but I wondered if you could help provide advice for people listening who might be thinking about splenectomy, either an adult or parents of a child who has pyruvate kinase deficiency, and wondering if you could provide some thoughts about how they could go about this shared decision-making and individualized approach. I think that in an ideal world, that's what we recommend. But I think for some individuals and families, this is difficult because their provider may not see a lot of patients with pyruvate kinase deficiency or feel well-informed around helping that shared decision-making and individualized approach. So could you share some thoughts about how families might go about this decision-making when they may be seeing a hematologist who doesn't feel well-equipped to have that kind of approach?
Yeah, I think we encounter this on a regular basis, especially in pediatrics, since this is a rare disease and there are very few pediatric hematologists who take care of patients in this setting, and also more so in adult hematology because there are very few adult hematologists who take care of patients who do not have cancer. So we encourage providers and also during community education to help refer patients to centers where the hematologists were comfortable managing these rare anemias or pyruvate kinase deficiency. So trying to get to speak to someone, even as a virtual appointment, may actually help in understanding the treatments available and including splenectomy. But I think it's like we mentioned earlier, I cannot emphasize that educating the patient family about the risks of splenectomy. So I usually try to meet with the family, understand, is this patient someone who would benefit from splenectomy or not? Because as we discussed earlier with regards to the severity of anemia, the transfusion need, etc. But more importantly, describe the risk of splenectomy, especially the post-splenectomy infection risk is about close to 10% in patients with pyruvate kinase deficiency and can be variable, especially as they accumulate further risks throughout their lifetime. Then we have to talk about important vaccinations that may be required before the spleen is removed and ensure they are appropriately vaccinated against certain bacteria such as pneumococcus, meningococcus, Haemophilus influenza, and also ensure that the patients receive timely boosters the splenectomy for years to come, like you already mentioned earlier. I also ensure that they understand the risk of infection, that if they have any fever of more than 101.5 degrees Fahrenheit, that they should consider it as a medical emergency and seek help, reach the nearest emergency department. I often discuss having antibiotics at home in some of these patients, especially if they live really far away. They cannot get to an emergency department at a reasonable time. While they call for help, that they can actually start an oral antibiotic while they're actually on their way to the emergency department. While the risk is still very high in those who are less than 5 years of age, I still say that we still see patients as old as 40, 50, 60 years of age presenting with severe sepsis and potentially being life-threatening. Again, we discuss the risk of thrombosis, and also we talk about they have additional risk of having a blood clot in addition to splenectomy. And then we discuss of using medications such as anticoagulation or prophylactic anticoagulation or blood thinners that can help prevent blood clots. So prophylactic antibiotics are also recommended in patients with infections. We usually say the risk is high 1 to 3 years after splenectomy, but we know the risk is lifelong. So prophylactic antibiotics and prophylactic anticoagulation are two things that we discuss, and also discusses the pros and cons of using this medication. Like any medication, adherence or compliance is very important. It's important to recognize that as well. So several points to discuss with these families, and I often let them go home and bring them back again the next visit to go over some of these again, so to understand the importance of these and then take the decision for splenectomy and watch them very closely.
Before we close, I wondered if you had any comments that you wanted to make about the spleen and pyruvate kinase deficiency or management of anemia in general.
The spleen, again, it's a very important organ. We used to remove spleen a lot more in hemolytic anemias in the past. So I think as a community, we have significantly reduced the number of spleens that gets removed. But I think it's important to recognize that splenectomy is still an important option and can be quite beneficial in some patients. Having that discussions early on is actually very important. If the families bring that up with the provider, so the providers actually discuss it with the families. Management of anemia is very variable. So it's important that while there's minimal data in pediatrics and there's more data in adults, I think it's important to recognize that the need for transfusions may be different in different patients, because we know that pyruvate kinase deficiency is such a heterogeneous disease that the severity is very different. Biggest take-home point is that it's very patient-specific, and also there could be a slight differences in how different providers also practice medicine, including in patients with pyruvate kinase deficiency. Hence, we have guidelines that can certainly guide these providers so that there's a uniform treatment for patients with pyruvate kinase deficiency across the globe.
Dr. Chonat, I want to thank you for joining today's podcast and for all your insight into the role of the spleen and splenectomy for individuals with pyruvate kinase deficiency. I enjoyed our discussion, and I know the listeners will too.
Thank you so much for having me.
Thanks for listening to Just Listen, Voices of Pyruvate Kinase Deficiency. Don't forget to hit that follow button in your favorite podcast app so you don't miss an episode. Share the show with members of the PK deficiency community. And if you'd like to learn more about PK deficiency and see what resources there are to support people impacted by PK deficiency, visit knowpkdeficiency.com. That is knowpkdeficiency.com. Thanks for listening. I'm Dr. Rachel Grace, and we look forward to talking with you again.